Hello and welcome to the special program on International Youth Day brought to you by the Meghalaya AIDS Control Society. Now, what is International Youth Day? Why do we celebrate it? What is the theme of International Youth Day? I have with me three guests today. First of all, to my left, I'll introduce Kong Jasmine Lingdo, who is a clinical psychologist with Nazareth Hospital. To my right is Kong Nadine Pakenten, who is an assistant professor with the Martin Luther Christian University, I believe. And lastly, but not least, I have Yarabha Shangrit, who is a student and he studies law at the Northeastern Hill University. So welcome all three of you.
Thank you.
And I hope we are able to enlighten our audience with this discussion on International Youth Day. So first of all, let me start by asking Kong Jasmine here. International Youth Day. The theme is youth engagement for global action. What do you make of this?
As we are celebrating this International Youth Day, I do understand that our population largely composes of the youth. So, what is happening in the world is that they are allowing the youth to participate in all kinds of, policies, in all kinds of activities that will contribute towards their knowledge and also that will contribute towards their participation in bringing about a change in the world. So the theme of this year is how we can engage them.
So the official theme is youth engagement for global action. That's the theme, so that's what you've touched upon. So I'll move on to Kong Nadine here. What do you make of the theme for International Youth Day, youth engagement for global action? You're a teacher, an assistant professor, you deal with young people every day.
Yes.
So this year, especially in the time of COVID-19, what do you make of this commemoration of International Youth Day and this theme of youth engagement and global action?
I think it is a good opportunity for boys and girls together to actually make a change in different spheres, because when it comes to youths, they are not very well engaged when it comes to political spheres, the social spheres, the economic sphere. So it is a good chance for them to actually come together. And we have different boys and girls, the youths who are coming out during COVID-19, during this pandemic. They're not actually that scared. They're coming out and they are helping the community people at a local level, at their own communities. And this is something that my students also are doing, the students from the social work department. We give them an opportunity. We don't force them. It is optional. We tell them, if you want, go. Get yourself engaged in the communities. And they do that. They go to the quarantine centers. They wash up the quarantine centers. They help to serve food. Those type of small things. It makes a big difference. They provide with masks. They provide people in the community with masks. So it's something that's nice to see the young boys and girls.
So you've been seeing youth engagement at least for local action
Yes.
on a practical level every day.
Yes.
Okay, so moving on to Yarabha. What do they call you for short? Surely that's a long name.
That's the only...
Nobody
that's
says
the
hi
only-
Yarabha, right?
No.
So Yarab, as a student who studies law in Nehu and who is of course the prime target of International Youth Day. Your voice is of course the most important voice because this is about youth. What is your take on this, on International Youth Day and youth engagement for global action?
So being a youth, being a law student, mostly I am involved with a lot of social activities, and seeing that with all the things, this crisis that has come to our nation and to all over the world, we have to take part in a lot of activities when dealing with this pandemic. And what I can say is that there are various organizations that have been putting their working day in and day out to try whatever they can to help, and we've been part of it. And as a youth, we go around sanitizing localities, and not just we are not scared of what is going to happen to us because we know the pros and cons about all these things. So being a youth, it is important that we are aware of what's going on around us, and that we're not scared, and that we see that various organizations and especially the government would help youths by giving opportunities. And when we see opportunities, I bet for sure that, you know, there are many youths within this city and all over the world who would grab that opportunity and do something about what's going on in and around.
So I will move on because, of course, I haven't mentioned, we were actually talking about International Youth Day, and all three of you have mentioned the pandemic. Of course, we can't ignore the pandemic. And this is, of course, also a program that's brought to you by the Meghalaya AIDS Control Society. Now, as they say, this generation, Yarab's generation, is the first generation not to know, you know, a world that doesn't have HIV/AIDS. Right? This is a generation that is, you're overflooded with the real threat of HIV/AIDS, and of course, on International Youth Day, there's no way that we cannot talk about HIV/AIDS, and because this is a real issue, a pressing issue among the youth. And first of all, I will ask my question to Comrade Nadine. I think so. Tell us about you know, the importance of remembering, you know, the basic things about HIV/AIDS on International Youth Day. What are these things that we should remember and keep in mind?
Well, there are modes of transmission that we have to be careful about. These can be blood transfusion, where HIV/AIDS can spread to another person. It can be through sexual contact, when a person is not using protective means. Then it can be injecting of syringes, where they share injections when they're using drugs, or even if they're not using drugs and, you know, injections are shared. That's how, you know, HIV can be transmitted to another person, and also from a mother to child. When a mother is giving birth to a child, during that time, the child can also contract the illness.
But these are very important basic messages that we have to keep in mind, the modes of transmission. You're a teacher, you deal with young people every day. Do you feel that this threat of HIV/AIDS is it felt every day?
I think it is a hidden threat that most people are scared to talk of. They're scared of the stigma. Stigma comes from fear, because people are not well aware of the modes of transmission. They're not well aware of where to go for, you know, for medical help. That is why that fear is there, and we should, as youths should raise that awareness. And then there is a therapy, the antiretroviral therapy, which provides, it's a medication. It doesn't stop HIV/AIDS, but it helps the immunity of a person to stay at a very balanced mode, to help a person be healthy. Now, all these days during this COVID-19, people are worried about coronavirus. Actually, people who are having HIV/AIDS are having a lot of problem because of the lockdown. They could not go to the hospitals to take their medication. So I know a few people from the Shillong Endurance Motorsports Club, then Ri Khasi. These people are actually going to, door to door to provide the medication for people having HIV. And the SP of East Jaintia Hills, East Jaintia Hills district, he's actually providing food for people who are having HIV/AIDS, because nutrition is required. They have to be healthy. So they're trying in every way to help people who are having HIV/AIDS, and I think this is something which is really good to see from the youth point of view. Like, the youth should be coming out, they should be doing something.
So COVID-19 and the whole lockdown and this pandemic has been especially tough on people who live with HIV/AIDS, and it's very heartening to know of all the help that's been given to them. So let's move on to, because we just can't seem to escape COVID-19, Jasmine, and we're still living in the midst of COVID-19. We're still suffering from it. So in this, on International Youth Day, what are the basic things that we should remember, again, to remind ourselves of this threat of COVID-19?
Yeah. So what we are seeing now is a lot of returnees who are coming from states which are having a large number of the COVID-19. So what happens is, these are also students, these are also people who have come who have had to leave their jobs to come back to the state. So it's very important for our youth to understand that they have to follow protocols, because the spread of COVID is through contact. So what happens when we throw caution to the wind? When we don't wear our masks, or when we don't, observe some hygiene, hand washing, or we don't, observe our, say maybe even distancing. I think our youth play a big role in how we can spread this message of following protocols. Our youth also can play a big role in how we help people who are actually being stigmatized and who are actually being discriminated because they have contracted the disease. It's very encouraging to hear from Nadine and from Yara that the youth are actively involved in managing these quarantine centers. If we look at a large population of our office workers who are in those quarantine centers, they are youth. Because they are still, in that very healthy age, I guess. Their immunity level is still very high. So, it's encouraging to see how much they're sacrificing to be in those quarantine centers. It's so important for us to understand that nobody wants to contract the COVID-19. So we should respect people when they are in, when they have this disease. Instead of, looking down on them or calling them all kinds of names or labeling them as COVID, or, giving all kinds of false messages about how they have contracted it, where they went, what they did. I think it's so important for us to keep a balance. I think what is most important now to understand is our youth are in a state of very, uncertain times. They don't have their regular classes. They don't have their socializing, which can be quite stressful.
I'm sure it is. Yara will tell us all about it.
So, it's very important that they maintain their calm. The World Health Organization has repeatedly been talking about how important it is for us to maintain our mental health, because a lot of young people are becoming very anxious. They're becoming depressed because they're frustrated that they're not able to do their normal things. So I think for this, on this, very important discussion, we need to spread the message among the youth that, this COVID will not last forever. We have to be patient.
So Kong Jasmine had touched a bit about stigmatization there, and of course this is a campaign that the government has very forcefully adopted, stigmatization of people suffering from COVID. You touched a great deal about it. And so basically what you're saying is the role of the youth in stopping stigmatization or in trying to combat stigmatization has largely been a positive one.
Yes.
So I'll move on now to Kong Nadine. Now when we talk about stigma, then the people who've suffered stigma more than most are people who are living with HIV/AIDS, the people who've lived with HIV/AIDS. Tell us, what are the things that we need to remind ourselves? Like Kong Jasmine had said, we need to keep reminding ourselves that these are fellow human beings, that this is a disease that we need to keep in mind, that this is a disease that eventually, with following the protocols, it will be cured. So there's no need to spread false messages. There's no need to black mark anyone. But this has been going on for a long time with HIV/AIDS stigma. Do you see, or have you seen, for example, any success in stopping stigmatization of people living with HIV/AIDS?
I think this is something which is ongoing actually. I have good friends who are positive and they come out. They've talked about their their illness, and they're not shy because of stigma, because they want to stop it. They want to come out for the rest of the community who are having HIV/AIDS, and that is why they've stood up. They say, "Hey, I have HIV/AIDS, so stop slandering me." People are actually, because of not having the right information, not knowing what are the modes of transmission, not knowing about why people are getting HIV/AIDS. That is one of the reasons why that fear is there. So my advice would be that people need to educate themselves first. Before you talk about something, first educate yourself, get to know what is this illness all about. But people can maintain their health. There are medication for it. So the rest of the community who are not having HIV/AIDS, instead of slandering the ones who are having HIV/AIDS, I feel that they should somehow come up with a way to support. People who are having HIV/AIDS, many times they shy away. They don't talk about their illness, they don't talk about their status because they're scared of what my parents will say, what my brothers, my sister will say. They're scared of their uncles, what will my uncles or aunts will say about me. And that is why, because of that, it stops them from going to, medical checkups, for getting their medications. So there's a lot of going and coming, and people have to really, really be supportive in order to help.
So the word stigmatization, for example, has gained a lot of currency, especially now during COVID-19, and we've learned about the ill effects of stigmatization, how we should not stigmatize. Do you think this will somehow translate, maybe post-COVID world, people will learn to be kinder and maybe learn that stigmatization is not something that you do to people suffering from any disease? We didn't do it, or we learned that it was wrong to do it during the pandemic, COVID-19, and it is wrong now to do it with people, for people living with HIV/AIDS. Do you think that, do you see that happening?
I think that people are, they're born good from the inside. And we have to give them that chance first to learn about the illness. Then only people will stop stigmatizing. Otherwise, it will not stop. And yes, you're right, people should start being kinder. We should have a kind campaign, especially among the youths. These type of campaigns will actually help create more awareness about different illnesses. We're not just talking about HIV/AIDS, we're not just talking about COVID-19. There will be more diseases later on. So we have to learn to be a kinder human community.
Yara, do you think, because if it's going to be a kinder human community, as you said, it will have to be from the youth, right? The old people are gone and done and dusted. But the youth will have to forge this new world, this new human community, a kinder, more understanding human community. Now, as someone who is a young person yourself, do you see this positively? Do you see this happening? Are you hopeful for something like this happening?
Yeah, I would say that I'm very hopeful for it, because when they say charity begins at home, I do believe that if I have a parent who doesn't stop me but instead teach me about the ill effect, and to equip me with things that I will not be afraid to move out and protect these people and help people who are victims of such diseases and such viruses. I don't think it's impossible. Everything is possible. But when we talk about our community, our locality, there are areas where they lack a lot of education, they lack a lot of knowledge about all these diseases. And by doing that, I would like to urge the government, the higher up, whoever is in the power, to not let somebody who's from outside, who doesn't understand our community, to come in and teach them about it. Because at the end of the day, the only person who will make them understand, who will give the knowledge that they really need, and to stop this stigma, is by bringing someone who understands the community.
So you're saying that you need someone local, someone who understands our ways and our cultures, and I think that's a different discussion altogether. But I was sticking to the fact of, from your perspective, do you see the forging of this new and kinder human community? And you're saying that you're hopeful about it. Mm-hmm. Of course, there are lots of youth movements around the world that are trying to forge this kind of new solidarity, this new thinking, to take us forward. So, as part of youth engagement for global action, theme of International Youth
Okay.
Day 2020, what are some of these movements that inspire you and maybe that you think people should know more about, especially the young people?
So when we talk about locally, we have a lot of organization who are involving youth. You talk about colleges. They have various organizations like the NSS, the NCC, the Bharat Scouts and Guides. These are organizations that involve youth in doing a lot of things within our localities and in and around the state. Now we have various organizations that have set foot in our nation for quite a long time. Organizations like ISEC, the United Nations, these are organizations that has increased in various levels into giving opportunities to youths. I've been a part of this organization, bringing in this organization for the first time in Shillong, and I thought about it various times on how to involve youth in it because I'm a youth and I don't have a mentor or somebody to tell my fellow youths to join in. So what I did was I had to volunteer abroad, and when I did that, I had to do my best so that youth get inspired and they're willing to join. And we have had many students who go abroad and did a lot of projects on SDG goals, and we did on climate change, we did on their quality education and various other SDGs. And so I think that it is important for youth to be involved, and it is only possible when we provide them, our government give chances and recognize these youths. We have a lot of youths in Shillong like Nangjok Norum, who cleaned the city of Shillong.
Yes, right.
All by himself, and he needs a lot of
So
recognition.
which brings me back to the question that I was going to ask you. Do you think that the youth of your generation, this generation, is socially more conscious than maybe the generations that have come before? Do you think they're more socially active?
I would say yes. Why? Because there are many organizations now, and these organizations would like the youths to get involved. You try to search for numbers to your organization. The only possible way is the youth, and that is how an organization works, and that is how
Among your friends, say if we don't, of course, there are the organizations. There's always the institutional support, but among your peer group, among your friends, do you feel that you end up talking about social issues more?
Yeah,
And does
of
it
course.
take up time when you're hanging out and
Yeah, most of the time when we hang out, it's always about we talk politics. I'm in the NEUSU as well for 3 years, and we talk a lot about how to help our youth, especially the education policy of the state, and when a board like NEHU, how it should be, it should progress. And when we talk about all these things, we do protest and we do shout and we do raise our voice most of the time.
You're saying it is. You're actually. Do you agree? Because you're a teacher. Normally, the sight of students protesting would terrify you. But do you agree that the youth of this generation are socially more conscious than maybe someone from your generation?
They are actually, they're quite conscious. I mean, if you talk about people like Eric Dakhar or Russell Wajri, they are working towards, there's an environment plan that is being written down, they're working towards that. And then you have people like Ma'am Shannon Masar, although she's not a youth anymore now, but she started her work when she was a youth. She started Faith Foundation. I mean, there's so many different organizations that people coming out, they're not social workers. Some of them, they didn't study social work and they started out their NGOs. So we can see that yes, youths are becoming more and more socially aware about, what is happening around them. And it's good to see that.
And what's most interesting is that a lot of youth now are involved in YouTube making, and YouTube as a platform where a lot of students and a lot of youth are learning a lot of things, and we have youth from our community doing all of that as well. So I think it's really good to see that.
So which brings us to the next topic, which is behavior change. And this is, if you're talking generally about a generation that's very active, then change in behavior or behavioral change should be easy. Do you think it is as easy as that? What are the what are the key things that you think, even though for a socially conscious, active generation, what are some of the things they should keep in mind to affect real behavioral change?
I mean, if it's with regards to COVID-19 and HIV
And
AIDS
HIV/AIDS, yeah,
together,
both, yeah.
okay, the first thing first is that we need to follow protocol. Whatever protocol the government has given us, we need to follow them, like wearing a mask or washing our hands. These type of protocols are important for our safety.
Mhm.
That's the first thing. They have to follow it because they want to go and work in the community. So they have to follow the protocol first. The next thing is they don't have to run to far off places to talk to people. They can start with their family, then the community, neighbors, friends. Talk to them about HIV/AIDS. Talk to them about COVID-19. Tell them about what is it really, what is this illness. That is how stigma stops. We come back to stigma.
Mhm.
That is how stigma stops. When we start to educate people around us, and only youths can do this. I'm not saying that adults cannot, they can, but then the youths are more enthusiastic, they're more healthy, like ma'am said before. The immunity is quite good, so they can go out and do this type of work.
So, if we're talking about HIV/AIDS here, for example, you're talking about people opening up a bit more and people being less afraid of this dreadful disease that they live with. What are aren't we asking too much for an individual to do that?
Yes, we are.
So what is the sort of support available, in terms for someone who wants to do that? I know that Meghalaya AIDS Control Society has pushed this campaign of 1097, I think, and also to get yourself tested. They've been organizing a lot of campaigns for young kids, for young people to go and get themselves tested, and of course use 1097, the toll-free number. Now something like this, taking those two things, 1097 and getting yourself tested, what type of behavioral change would we need, for people to effectively use these services?
The first thing first, I mean, if you look at the modes of transmission, the behavior change also has to come from the modes of transmission. Like for example, using of a condom. There's nothing to feel shy about to talk about condoms now. You have to use a condom when you're having sexual intercourse. That is the first thing. The next thing is not sharing of syringes when you're injecting drugs, because youths these days, they are quite using drugs frequently. The rates are going up. So they have to understand that there are organizations which are providing syringes to them for free. They should go to those organizations. We have an entire community of people who are having HIV/AIDS, who are helping people, young boys and young girls, who are, falling into HIV/AIDS. This, you have Meghalaya State Network for Positive People. You can go there, you can talk to them, they will help you. The entire process of counseling, then going to, a health institution, for example, a hospital, they can go there. There'll be somebody from MSNP Plus or somebody from MAX who will be there with them. They will not be alone.
So to sum it up, you're saying that first of all, it's the effort of the individual to affect this behavioral change, to open up more. And you're saying that once you open up, you have the institutional support there, like the people, the statewide network of people living with AIDS, HIV/AIDS, and there's of course the Meghalaya AIDS Control Society.
Yes.
So those are points from your side. Well, Jasmine, let's talk about this helpline 1097. Being a clinical psychologist, you're used to people confiding in you. Do you think that people calling up a helpline, do you think that helps? Is that behavioral change? Because it takes a lot for someone to pick up a phone and say and to confide, to someone at the other end of the line. So do you think that this is something that what type of behavioral change, what type of change of attitude do you think you need for people to pick up that phone and say, I need help?
So, as a psychologist, I think the most important thing that we really have to keep in mind, is that shame and guilt of having done something and contracting, say, maybe certain diseases. I think it's important for the youth to understand that there are so many options, like Nadine has spoken about, that there is a support system. So reaching out to that support system is such an important thing for our youth. And if we are looking at any kind of behavior change, I think the most important thing is awareness. Be aware of what are the things that can help you prevent these diseases from happening. And secondly, even if it has happened, what are the options that are available? So read up, talk to people, get into groups that actually are, specific for these kind of conditions. Be mindful. Be mindful of what you can do to bring about a change in people around you also. A lot of times we have found in the hospital setup, when you talk about HIV, is that they are so, that irresponsible behavior. They know that they are positive, they have a positive status, but they are not taking precautions. So that can be a behavior change for them, where they take responsibility for what it is that they have, what condition they have in them, and to follow certain protocols. The same thing can be even for COVID-19. If they know that they are positive, take some, maintain distance, or go into quarantine. Don't break these quarantine protocols, thinking that boredom has set in. So a lot of them are running out of these quarantine centers also because they are bored. But we have to ensure that we actually, at least follow certain strict disciplines. So I think discipline is also one way in which we can bring about behavior change.
Obviously. So we've heard Nadine and we've heard Kong Jasmine. As a young man, as a young person, when you're talking about behavioral change, I'm sure you're looking at it from the aspect of a lot of things. You're looking for change, maybe not just from people, but institutional change from the government. Mm-hmm. So what is the sort of behavioral change that you're looking forward to, that you expect?
So, as a youth, the kind of behavioral change that we look upon is when we see a leader who is going to understand the needs that the youth wants. When most of the time when we talk about awareness, what's the point of giving awareness when you don't give an opportunity to exercise these awareness, to bring it into action? You're giving out awareness, but you're also giving space for them to forget the awareness. So as a youth, I see that all the time. I feel that all the time, and I've been a victim of that. When I was in Guwahati having an awareness on COVID-19 before it even exists in the Northeast, I came back and helped the government. So I do not forget these protocols. But how many youths would get that kind of an awareness and would get to exercise all these kind of things? So exercise is also important. When you get awareness, especially in the rural areas, you can't say that you'll bring in people from outside can come in that locality and you feel bad and feel stigmatized by when people in that locality chase you out. Mm-hmm. Because at the end of the day, they are not aware of the kind of things that you are aware. So basically what I look upon is that with awareness comes action, comes exercise, and that's it.
Okay, so we come to youth engagement for global action. So I'll just finally, before we wrap up, you touched upon this support network for people living with HIV/AIDS, and would you like to just elaborate on that before we wrap up? The support, for support for people living with HIV/AIDS, to remind ourselves, and of course to remind people who are listening, perhaps, of the support available to them.
There's a huge support system that is available to people who think that they have HIV/AIDS or who have tested. Now, the first things first, that you must know your status. So you have to go to government hospitals like civil hospitals where we have a center. Okay, you go to the center, they will help you. ICTC center, the Integrated Counseling and Testing Center, you go there, they will guide you, they will help you, they will get you tested, and then you'll know your status. You will receive counseling from them, and then from there you will be directed to the Meghalaya State Network for Positive People. You'll be directed to the Meghalaya AIDS Control Society and different other organizations which are working for people having HIV/AIDS. And from then on, you have to understand that medication has to go on regularly. You cannot stop your medication. You have to keep yourself healthy. So keep taking your medication. Avoid doing things which might, spread the illness to somebody else, to spread the virus to somebody else. So those are the things that, they are available to them, available to you as a youth, as people who are think you are having HIV/AIDS. After that, now the question comes whether you talk about your illness, your virus to somebody else. I think this is something which is very individual. Okay, so it's up to you whether you want to talk to your family or not. There will be a counselor who's always available to you. And then I think that's about it.
Thank you very much. So, Kong Jasmine, finally from you, the importance of psychosocial support for people living with HIV/AIDS and of course COVID-19. This is very important. So as a psychologist, there must be a few things you have to say about that.
Yeah. I think like you have said, we need to be kind. If COVID is teaching us to be a kind society, I think we got to seize this opportunity and learn how to be more humane in our approach. It's very important for our youth, okay, to seek support, because a lot of our youth are having this, existential kind of crisis, a lot of rethinking they have to do. They may not be able to do it on their own, so they need to reach out. If you're looking at the facilities that are there, schools are closing down, but teachers are available online. They need to reach out to the teachers if they have any problems with their studies. Then they need to reach out also in their own homes, okay, because a lot of our youth actually don't like to spend time with their family members. But I think now this COVID is teaching us that, oh gosh, we have to spend time with our family members.
Good or bad, we have to.
So that can be looked at in a positive way. Okay, and I think the most important thing that we really need to understand is to stop too much of the social media, which gives a lot of negative messaging. Focus on the positive things that are there, your potentials, because you can share your creative potentials with others around you. It's a good time for the youth to also do a lot of small projects that they can do with the assistance of the adults. So this social support is something that really plays a big role in how we can handle this very, very uncertain times, especially during COVID. And the most important thing is that, when we know that somebody is in trouble, I think we just need to reach out and give some supporting, some encouraging words to people who are in need of encouragement.
So we come back to that, of being a kinder, a gentler society.
Very.
Finally, a message from you, from the only young person among us, on International Youth Day when it comes to HIV/AIDS and of course COVID-19.
So, Ma'am Jasmine talked about mental health earlier, and I want to stress on that, because as a youth we suffer in that a lot. We have depression, and I am a victim of depression. But at the end of the day, we must understand that it is how we have to take care of our mental health. It is of saying no to certain things that, for example, my name is Help, but I don't help each and every one that asks for my help, because at the end of the day, I'll be burdened by it. And what comes of that is depression, and my mental illness will be bad.
Anxiety.
So, hence, my message to all the youths is that we have to take care of our mental health, and we have to stay strong and be patient with all this pandemic that's been going on, and we'll get there as a youth and as a generation. Thank you.
Okay, perfect note to end with there. So we need to be of more help to each other, as Yarab says. And do remember, this program is part of the International Youth Day special brought to you by the Meghalaya AIDS Control Society. We will wrap up now. I would like to thank Kong Jasmine, Kong Nadeem, Yarab here for joining us in this special discussion. And of course, do remember that as part of International Youth Day, the Meghalaya AIDS Control Society is also organizing a competition for all of you who would like to participate in a liners competition that is composed from verse, I think. And there's also a DIY competition that they're organizing. So last day to submit entries for that is the 24th of August. So do check that out online. Prizes to be won there. And before we wrap up, I'd just like to wish all of you here, and of course all of you who are watching there, a very happy Independence Day 2020. Thank you.